Hello, my name is Amir. I'm the Hematology Registrar. Welcome back in the Let's Bleep Hematology channel. Today, our topic is warfarin and low molecular weight heparin bridging. We receive call from medical and other departments sometimes that the patient was on warfarin and it was interrupted because of a bleed or because the patient had a procedure. That's why we stopped the warfarin for a few days and now we want to start it again. Can we start the warfarin and what is the dose that we should start with? So, warfarin cannot be started alone if it is interrupted for at least 72 or more than 72 hours. You need to bridge it with low molecular weight warfarin. Then people ask what is meant by bridging. Bridging means combination of low molecular weight heparin and warfarin. Then, when you say combination of low molecular weight heparin and warfarin, the medical team or other department team will usually panic that we are combining two anticoagulants. The patient may bleed. This is not what happens in reality. Warfarin takes time to show its effect, uh, and for this period, till the warfarin show its effect, we cover it with low molecular weight heparin. Why? Because warfarin is a vitamin K antagonist and it prevent the formation of some of the clotting factors and some of the anticoagulants as well, like protein C, S, etc. So once protein C and S are inhibited, they are natural anticoagulant. The clotting factors, which has longer half-life than the protein C and S, they still remain in the body and make the environment procoagulant. That's why patient usually develop skin necrosis if you start warfarin and you do not bridge it with low molecular weight heparin. So to prevent skin necrosis in the patient, we give them low molecular weight heparin, and then we check INR on day 3 of the bridging. Once the INR is in range, if the patient has a range of INR 2 to 3 or 3 to 4, uh, if the INR is in range, then we will stop low molecular weight heparin and will continue with the warfarin. So, warfarin cannot be started alone if it is interrupted for some reason. You need to ask the hematology team regarding the bridging, how to start combination low molecular weight heparin and the warfarin. Usually, we give a double dose of warfarin on day 0 when we are starting bridging between low molecular weight heparin and warfarin, and then after that we give the patient normal dose and check the INR on day 3, and then adjust the dose of warfarin according to that INR. So the basic aim of this talk is that do not start warfarin alone if patient warfarin has been interrupted for some period of time. Always bridge it with low molecular weight heparin and check INR on day 3 of this combination medication. On day 3 INR, adjust the dose of warfarin. Once the INR is in range, stop the low molecular weight heparin and continue with the warfarin. This is to prevent skin necrosis in the patient because of rapid inhibition of protein C and S, which are natural anticoagulant, and the remaining action of clotting factors, which will still persist in the body because they have longer half-life and they make the environment prothrombotic. To prevent this, we give low molecular weight heparin. Hopefully, uh, it will be helpful to you. If not, you should discuss with your hematology registrar or consultant and prevent the occurrence of skin necrosis in such patient. Thank you.